health tips to keep your body in the best shape possible. My name is Afuya Kumalo, and yes, I sing with focus, but I'm also a registered dietitian who gives you health tips to keep your body in the best shape possible. Today is one of a three-part series on basics on how to care for your diabetes. You're going to learn the basics of diabetes management, but you need to make sure that you follow up with your own registered dietitian as well. Most insurances will cover this visit. Enjoy and remember to keep your body in focus. In this course, you're going to learn the basics of diabetes, but it is no substitute for getting professional help from a registered dietitian. Take a look at this chart for the leading causes of death in 2013. Now check out homicide. You can see that you're much less likely to die from being shot than you are from uncontrolled diabetes or heart disease. How careful are you to make sure you're safe from these? In Lesson 1, you will learn what diabetes is, how to prevent and treat diabetes, careful meal planning, high and low blood sugar reactions, blood glucose control, complications of diabetes, and then we'll set some goals that will help you to maintain great blood glucose control. Since diabetes can be controlled, prevented, and reversed by diet, then it's safe to say that a lot of these complications with diabetes, amputations, blindness, and so forth, are an outcome of a poor diet. They can be prevented. With diabetes, the way you eat is usually the way you feel. If you don't eat well, you are not going to feel very well either. Everyone with diabetes needs to make a good management plan. With careful meal planning, it helps to control your blood sugar, and this cuts down on your risk of having different complications. When making a proper meal plan, there are several things to keep in mind. You want to keep in mind your knowledge about food and nutrition. Make sure that you know there are individual preferences. Everybody's different and everybody's lifestyle is different. And then know your individual health needs and tailor those to your individual food plan as well. These will help you to make adequate and acceptable meals. And make sure to ask your doctor to refer you to a registered dietitian who can help you make an individual plan work well for you. Most insurances will cover a registered dietitian visit. There are several ways of planning meals with diabetes. See what works well for you. There are exchange lists. You can use carbohydrate counting or the constant carbohydrate method. These are some different things that may help you to be more balanced with your meal planning. Here are some basic tips to start your meal planning. Eat a well-balanced diet. Eat about the same calories every day. Make sure that you eat your meals around the same time every day. Manage your carbohydrates well and carefully. Reduce the amount of fat that you're eating. Maintain an appropriate weight. If you're overweight, lose the weight. Eat plenty of dietary fiber. You can never get enough. And then make sure to avoid foods that are high in sodium or salt. Read your labels for sodium. What I'm showing you here is a graph of healthy or good blood glucose control. You can see that it peaks a little bit and goes down a little bit, but not too high and not too low. It's balanced. Both high and low blood sugars cause complications. High blood sugar or hyperglycemia is caused when you have too much food or too little insulin or diabetes pills. If you're sick or stressed, it can also cause high blood sugar. The onset is usually slow, and it may even lead to a medical emergency if it's not treated. Some of your symptoms are before you: extreme thirst, dry skin, drowsy, urinating often. These are a couple of symptoms that you may feel. You need to test your blood sugar right away, and if you see that over 3 days your blood sugar has been high, go ahead and make an appointment to see your doctor to investigate what's going on. Low blood sugar, also called hypoglycemia, is a problem when you have too little food or you skip a meal, if you take too much insulin or diabetes medication, or if you're a little more active than usual. The onset is usually sudden, and you may even pass out if it's untreated. You might feel shaky, your heart is beating fast, sweating, dizzy, anxious, hungry. Your vision may be blurred. You might have weakness or fatigue, a headache, or you might feel irritable. Notice that some of the symptoms are similar to high blood sugar, so you need to make sure you test your blood sugar to see where you are. If it is low, go ahead and take a couple of glucose tablets or a piece of candy or just 4 ounces of juice, and make sure you follow it with some protein right away, and then recheck your blood sugar in about 15 minutes. If you're having several low blood sugar reactions, you need to make sure to tell your doctor so that he can tell you what to do. Good blood glucose control is the key. It helps to prevent complications, delay complications, or even slow the progression of complications that you may already have. Some of the terrible complications of diabetes, if it's not managed well, are problems with the eye that may lead to blindness, heart and blood vessel disease, kidney disease, problems with the foot that may even lead to amputation and foot ulcers, wounds that don't heal, nerve damage, and in men, sexual dysfunction is a very common problem when blood sugar is not managed. Every 3 months or so, you can go into your doctor and have him do a test called a hemoglobin A1C. This test is great. It tells you an average of what your blood sugar has been over the past 3 months. No secrets here. Your doctor can tell whether your blood sugar has been in good control or poor control based on your number. You want to stay in excellent control if possible, but if you get in poor control, you're definitely going to have problems with complications. So make sure you ask your doctor what you can do to prevent these complications and control your blood sugar better. You've learned a lot so far, and here are some examples of some goal settings for Lesson 1. Completing the sentence, I want to control my blood sugar by checking it 2 to 3 times a day, finishing this course and learning which foods affect my blood sugar, seeing a registered dietitian for ongoing nutrition counseling and lifestyle coaching, or losing weight to help manage my diabetes better. I want you to think about your personal goals. Go ahead and pause this video so you can grab a pen and a piece of paper to write down your personal goals. If you don't write it down, it's probably just a dream. Okay, great. So now let's go ahead and set 2 goals for yourself based on what you learned today. Go ahead and complete this sentence. I want to control my blood glucose by. Take this time to think pause the video if you want, and write down 2 goals that you want to do to help manage your blood sugar. Maria